But first, our top story remains the corona crisis that is confronting the country, with India now the second worst hit country, overtaking Brazil today. And amidst the surge, the biggest concern is perhaps over the hospital infrastructure, with a shortage of hospital beds being reported across the country. India Today's team of correspondents does a reality check at the very top on the state of our hospital infrastructure during the second COVID surge. Take a look.
These images from inside Lilavati Hospital in Mumbai expose the reality of the COVID second wave. This viral video shows how the prestigious hospital is using every bit of space to accommodate COVID-19 patients. Here, an entire lobby has been converted for COVID treatment.
Lilavati Hospital says that they have been overwhelmed by the sheer number of cases, and at this critical hour, rather than turning away the patients, they are accommodating as many as possible in whatever way possible. The video that went viral shocked the citizens, but the fact remains that every hospital in Mumbai is under a lot of pressure.
While Maharashtra is the state worst affected by the surge, neighbouring Gujarat is also reeling. Long lines outside the Ahmedabad Civil Hospital paint a different picture from the 700 daily cases claimed by the Gujarat government. State Health Minister Nitin Patel visited the health centres and announced measures to ramp up bed capacity. 2,000 more beds will be added soon in Ahmedabad. In addition, hospitals' community centres will be converted into COVID care centres.
पर राज्यમાં પણ સેંકડો દર્દીઓની સારવાર અમારી સરકારી હોસ્પિટલ, અમારી મેડિકલ કોલેજોમાં આજે પણ જેમ અમદાવાદમાં સારવાર અપાય છે એવી તમામ પ્રકારની વ્યવસ્થા સારવાર એ આખા રાજ્યમાં બધા જ શહેરોમાં અપાઈ રહી છે.
In Rajasthan, one of the states witnessing this sudden spike, smaller towns are found wanting. These images are from Bharatpur, where 2 to 4 patients are forced to share beds at the local healthcare centre. When confronted, the state health minister claimed ignorance.
मेरे को जानकारी नहीं है, आप बता रहे हैं तो निश्चित जांच करवाएंगे. मैंने अभी सीएमएचओ से भी कहा कुमेर को लेकर के कि मुझे जानकारी मिली कि गांव में 5 मरीज आए, तो मैंने कहा भाई गांव में शुरुआत हो रही है, इसको बचाओ. गांव में घुस गया तो बड़ा मुश्किल हो जाएगा.
Bengaluru, the city's IT hub, is getting ready to meet the sudden surge.
In Bangalore alone, I am telling you today, in the next 4 or 5 days, we will reserve earmark minimum 3 to 4,000 beds across all spectrum, government, private sector.
The national capital is also seeing a huge surge in COVID-19 cases. While it has adequate numbers of ordinary beds, nearly 80% of ventilators are used, only 249 are left. With daily coronavirus cases hitting nearly 1.7 lakh, health infrastructure is being tested in cities across the country. If the surge spreads to India's hinterland, the fight against COVID could suffer an even bigger blow. Bureau Report, India Today.
But it isn't just a shortage of beds now. There's a vaccine shortage, and there is also a shortage of the key antiviral drug Remdesivir. The government today stepped in to stop the export of Remdesivir. Also, the government has finally given the clearance to the Sputnik vaccine. What does all this mean? Why is there a shortage on the ground? Here's another reality check.
A shortage of COVID beds, a shortage of vaccine, and a shortage of antiviral drug Remdesivir. The fight against COVID is being hampered by unforeseen challenges. This is outside Zydus Hospital in Ahmedabad, where hundreds lined up over the weekend to get Remdesivir, a medicine prescribed to tackle serious cases. The shortage has sparked a political war as well. The state BJP unit distributed free remdesivir injections in Surat amid the ongoing crunch. The opposition is asking how the party could procure the medicine, which is distributed solely by the government.
CR પાટીલે પોતે સુરતની ચિંતા કરીને 5000 રેમડેસિવિરની એને કઈ રીતે વ્યવસ્થા કરી છે એ CRનો આપ પૂછશો તો તમને પ્રોપર જવાબ મળશે. સરકારે અલગ વ્યવસ્થા કરી છે અને ભારતીય जनता पार्टी तरफથી જે વિતરણનો કાર્યક્રમ છે એ પણ અલગ છે.
रेमडेसिविर महाराष्ट्र में उनकी शॉर्टेज है, सबको मालूम है. लोग एक एक दिन मेडिकल स्टोर के बाहर, सरकार के अस्पताल के बाहर क्यू में खड़े हैं. आपने देखा होगा, बहुत वीडियो आते हैं. ये राजनीति जो चल रही है, ये जनता के जान के साथ खेलने की जोखिम आप कर रहे हैं.
Following the huge shortage, the central government has banned exports of the drug. According to sources, India has exported 11 lakh remdesivir injections to 100 countries in the last 6 months. Not just remdesivir, even vaccines are in short supply. Opposition-ruled states Punjab, Rajasthan and Maharashtra are complaining of inadequate supplies that have forced many vaccination centers to shut down. To overcome the vaccine crisis, India has now approved Russia's Sputnik for emergency use. This is the third vaccine after Covaxin and Covishield to be cleared. With Milan Sharma, Bureau Report, India Today.
Let's raise the big questions then at the very top, the question that need answers. Are the center and the state governments losing control over this COVID fight? Was the government unprepared for a second surge? Does the vaccine policy of the Modi government now need a total overhaul? What explains the shortage of key drugs and hospital beds? Let's join our panel. Dr. Ashok Singh, Chairman Fortis Heart Institute, is joining me from Delhi. Dr. Sapan Panda is member of the Gujarat COVID Task Force, immunologist himself. Dr. Giridhar Babu is one of the country's leading epidemiologists with the Public Health Foundation of India. And Dr. Rahul Pandit is member of Maharashtra's COVID Task Force. And I want to come to you, Dr. Pandit, first, because Maharashtra has been the case with the maximum number of cases, even now 60% of the fresh cases. And now we are getting situation like in Lilavati, where people are being, even lobbies are being used for COVID patients. Is the state unprepared to deal with this surge? I want an honest answer. Why is it that the state seems unprepared?
So thank you very much for having me on the show. Rajdeep, the state basically have prepared for more than 20 or 25,000 beds in Mumbai and similarly in the other districts across the state. However, when the test positivity rate is almost at the rate of 23 or 24%, that is 1 in 4 or 1 in 5 people are positive. No matter how many beds you increase, the numbers are going to increase. Hence, these curves to basically try and perhaps bring down the numbers by putting up curbs on the movement of the people, night curfew or lockdown have been thought about. Now, have they been underprepared? I think that the surge which has happened very, very rapidly. And we as clinicians were also basically surprised at the rate at which the numbers have increased. In fact, they have quadrupled and doubled each week. And what we are seeing is almost a 2 or 3 lakh patients being added in Maharashtra every week for the last 2 or 3 weeks. So this is where basically the healthcare infrastructure is getting stretched. Some of the districts it is bad. Mumbai, I think, still has got some beds available. While you are seeing those pictures coming from Lilavati Hospital, there are around 1,000 odd beds available in Mumbai with the various jumbo care centers and other centers which are there. But some of the districts like Nagpur, Nandurbar, Nanded are very, very bad.
But you are accepting, doctor, very quickly that just the sheer number of COVID positive cases is making it more and more difficult for you to handle the situation. Am I right? In that sense, one could argue that maybe the state machinery was not prepared for the scale of this surge.
No, I don't think that's the state machinery. See, look, I am not from the task force. I'm a task force member, but I'm a clinician with Fortis Hospital. So what we can basically talk is that the state actually expected the surge coming up and they were preparing for that. I don't think that we could say that the state was completely caught off guard, but the rapidity of the wave has basically added to the problem. Another problem which is there is that a lot of patients up until 2 or 3 weeks ago were not that sick but were seeking admissions in the hospital. Now that all has stopped in the last 2 or 3 weeks completely. Only patients who require admission in the hospital are getting admitted. I still feel around 90% of the patients, up to 90% of the patients can be managed at home in home isolation quite well. And we need to basically follow those home isolation guidelines to the T.
Right.
And if we do that, this infrastructure will not get stretched. Even the current infrastructure will be easily able to tackle up this problem.
Sir, okay, let me just take that for a moment to Gujarat, because while the focus has been on Maharashtra, Dr. Pandya, there is Gujarat. And look at what the High Court says. Why was the government controlling the supply of remdesivir, where people are running here and there to get it? Even designated hospitals are saying they don't have it. We've seen videos of long queues of people waiting for remdesivir, reports that remdesivir is now being sold in the black market. The situation in Gujarat also is worsening. And remember, this is the Prime Minister's home state, Dr. Pandya. Why has Gujarat now also become a state that is struggling to cope with these numbers?
Thank you, Rajdeep. Well, it's I wouldn't say that it's the government which is handling the remdesivir. I mean, remdesivir was always available before also, and we were giving it even in the first surge to our patients, and in the second surge also it was available. I wouldn't say that they have kept all the remdesivir. They were just trying to, the government was just trying to help out the public by naming hospitals and saying that this is where they're going to be available, and sort of helping them out. The other thing we need to know is that I think there's a lot of hue and rush about remdesivir. You know, if you look at the trials which have been done, then it actually just reduces the hospital stay, you know, from 15 days to say 10 days. It doesn't affect mortality, and it's for moderate to severe patients of COVID-19. It's not for the mild to moderate cases where it's being used. So the second thing is that we need to know that where remdesivir has to be used. Obviously lead to a supply problem when it's being used in the wrong way. Anyway, the role of antivirals is questionable. That's number two. And number three is, I think let's accept it that, you know, our behavior as citizens of India, we don't wear masks, we gather in all kinds of things. So we are also to blame. I think it's both things. We have to, after all, what's the government? I think we are a part of the government themselves. So I think it's all of us together who have to see this through.
Sure. No. Look, it's not about citizens versus the government, Dr. Pandya, but let me again quote the Gujarat High Court. They are saying laboratories are now taking days to provide the RT-PCR test results. Earlier, the RT-PCR test results used to come in 8, 10 or 12 hours. It's now taking 5 days. Again, is it just the sheer volume of testing that's going on, of the fact that there is this growing demand, let's say for remdesivir, or indeed that hospital beds are in demand? Why is it? Is it just a question of demand and supply at the moment, or is there something fundamentally wrong with our infrastructure that we still aren't prepared for this kind of a surge?
Well, so the answer to your question, Rajdeep, is both yes and no. I mean, in the sense that we can always be better in whatever we are doing. But the other thing we have to remember is the absolute number in India. I mean, even if you see the mortality is about 1%, but that 1%, if you look at the sheer population of India, the absolute number itself is so high. It's a mammoth job to vaccinate so many in India, to get remdesivir for so many people. So, and talking about the tests, I don't think it takes 5 days. It takes about 2 days. But the problem is because there has been so much of a demand, and I know of technicians who are going for home visits at 2 a.m. in the night to collect the samples. So, I mean, it's just exhausted the kind of reserves we had. And in accepting that, you know, the surge, I think all of us were slightly complacent in the sense that, you know, there was various theories like the hygiene hypothesis that these things don't happen in India, that we were BCG vaccinated, and you know, these kind of things. So I think let's accept that all of us were responsible for these kind of things, and that yes, we can improve still further. There's always scope for improvement. But I think, as I said earlier, we all need to just be together in this and see this through.
Dr. Seth, who do we blame? Are we going to blame the citizens who became complacent because they thought COVID was over? Or do we blame a state machinery, both at the center and states, that also seem to lower its guard? Who do we blame here?
Rajdeep, this is a war-like situation. Remember, we only win this war if we forget the blame game. That one can do much later. But the real fact of the matter is, this is the steepest rise which anybody has ever seen across this planet, and also the most severest and virulent rise. So obviously this is not the same virus. The virus has changed its color and will continue to do so. The fact that we're taken by surprise is how an enemy attacks. So all of us were complacent. There's no blame game here. Unless we get together and unless we decide to work together, we're not going to beat this virus this time around. And that's why I think I'm going to move away from the politics of it all to say that we have to redefine strategies clearly. The syllabus has changed. We need to restudy it again, refine it, redefine it, and be very strict at enforcement, which is what we were lax at in the past. I think everyone's got to be together. Now, we may say that it's also our fault that we let the virus spread. We created a recipe for disaster, as you know. We actually unmasked ourselves. We actually were there. The political rallies were going on. The festivals were going on. And certainly some of the politicians weren't the biggest examples for the people to follow as well. So while we caught people and fined them, there were others who actually went scot-free on the TVs, on the cameras, actually saying that there's no need for masks on. So I think everybody is to blame, if you were to say, but to be saying that we were unprepared for the speed of it. Today, we have actually increased our bed strengths. We've certainly changed many of the beds to total COVID hospitals again today in Delhi. The same thing happened is that ICUs, 80 beds are converted. But Rajdeep, one important thing which everybody forgets in all this ramping up is the fact that last year in September, when the COVID cases were going high, the non-COVID disease processes were only 1/4 in the hospital. So it was easy to divert nurses, technicians, doctors towards treatment of COVID patients. There were hardly any non-COVID patients. And now we're absolutely full with non-COVID patients. Operations are going on, treatment of other disorders is on, whether it's trauma, whether it's orthopedics, whether it's neurology, whether it's cardiac surgeries, everything is on at this time. And therefore, there's not just overwhelming of the infrastructure in terms of beds, but there's overwhelming of personnel as well, overwhelming of doctors, nurses. And the same, by the way, it's the same ventilators which are going to be used for, say, a bypass surgery, which now have to be diverted towards a COVID patient. It's not extra ventilators that one provides. It is diversion of the same. And that's more difficult at this time when you have actually all cardiac patients into the hospital, all non-cardiac patients into the hospital, including COVID patients as well.
So what you're saying, I think you made an important point about the system really getting overwhelmed and exhausted. The sheer exhaustion levels. I've spoken to doctors who are saying that this second wave is just exhausting them more than anything else. Dr. Giridhar Babu, as one of the country's leading epidemiologists, is it now clear that this mutated virus is more infectious than the original strain? Can we say that now with some conclusiveness, with the result that over the next 3 or 4 weeks, the numbers could even go up further?
Yeah, thanks, Rajdeep. This is the time to actually examine what are the different factors which have led to this unexpected and almost exponential rise in cases. The threshold for population immunity has definitely been achieved, at least in some parts of Mumbai, Pune, and other metros. These cities having more than expected number of cases clearly suggests that there is a role of newer variant. Now, how infectious it is, what kind of effect it has on the virulence, those are under investigation. So in the absence of data, I am just following Occam's razor, saying that in the absence of other complex assumptions, I'll take the simplest assumption saying that probably the virus with higher infectiousness is the main reason. The second aspect, Rajdeep, is even though if it is a minor proportion, maybe around 10% of the people might be having reinfections, especially if they've had asymptomatic infection in the past, their antibodies might have waned, and there is evidence to suggest beyond 3 months the antibodies would wane, and they might be having the infection either with the older variant or with the newer one. As a combination of this, we have also provided a very conducive environment for faster transmission going on. So there are two aspects of this transmission going on, Rajdeep. One is most of the cases are asymptomatic. So therefore, we need to have a clear strategy in terms of how to strengthen home isolation and timely referral of those people who require oxygen. The second aspect is when the surge in cases occurs, even if it is a small proportion of mortality, the numbers are going to be huge. So how do we prevent that? So currently, more than the blame game, there is real issue of faster spreading virus. Now we need to ensure mortality is reduced by all our concerted actions at every level.
Let's therefore then ask you all for solutions. And I want to start with you, Dr. Pandit, because the buzz is that from the 14th midnight, Maharashtra is going in for a 2-week lockdown. Do you believe that's the way to break the chain, or is it to intensify the entire process of vaccinating people? Where does Maharashtra, which has the highest number of cases, start? Lockdown from the 14th night for 2 weeks, or is it by increasing vaccination? What's the strategy?
So I would actually just digress from the topic of vaccination or lockdown and just tell that first people need to understand that the COVID has got a 2 or 3 weeks timetable. It's not a 1 week timetable. That's one of the biggest problems which we have. Despite all the education and information been given, people feel that during the first week they had COVID, they had fever, then
Right.
second week is usually better. And then that's when they step out, they're still infectious at that time. And when the third week or the end of the second week is coming, they start becoming more and more sicker, and that's when they present to the hospital. So we need to know that. Second thing we need to promote is that we need to promote the isolation guidelines, and we need to promote a 6-minute walk test. 6-minute walk test is a very, very simple walk test, which essentially involves a person walking for 6 minutes in the confines of his room and checking on oxygen saturation. If the saturation drops down by more than 3% or below 93% at any time, he needs to present to the nearest healthcare facility, where more probably than not they would start him steroids and even send him back home because his baseline saturation is usually normal. Of course, the second thing which you mentioned rightly is that the vaccination process needs to be stepped up. Even if the lockdown happens, even if the government decides to put up a lockdown, there cannot be a 2 weeks vacation for vaccination. In fact, vaccination should be actually ramped up by several folds in these 2 weeks, and taking that opportunity to actually bring it closer to the patient's home,
Right.
increase more centers and do that. Now, whether the lockdown will bring the numbers down or not, yet definitely if you sort of stop people from meeting each other, it would bring the numbers down. There is also one epidemiological thought which some epidemiologists say that initially the numbers might increase because people would sit home and perhaps infect the people around in their vicinity or in their home as well. But that's a point which I think
Right.
most epidemiologists will be able to answer better. And the last thing which I think we need to do is double mask. I'm going to sort of talk about double masking now whenever you are stepping out of the house.
Double masking. You're saying that it is not enough to have a single mask. Double mask. You're also saying speed up the vaccination process. I want to ask you, Dr. Pandya, that in this strategy, will the government be transparent about the numbers? In Gujarat, there are concerns the government is not being transparent. Today, the government reported over 6,000 new cases, 55 deaths. However, one TV channel in Gujarat claimed that in just one hospital in Jamnagar, there have been more than 60 deaths. Our government's going to have to be much more transparent. How much testing is being done? How many people have been admitted? Is there an attempt being made to fudge the numbers?
Well, I'm not the right person to take that question, but I think that the government, they have their own ways of finding out the numbers of patients who are admitted or who die or who are tested, and I'm sure that they're going by those calculations and what the government sources are. And people come to know through other sources, through their areas, and so those are numbers which the government might not be able to pick. I'm sure the government takes care of the error as well. But having said that, I think one of the things that I would certainly like to say, and I would add to what Dr. Pandit said, is the misconcepts regarding the vaccine. You see, the herd immunity can be only by two ways. One is when the virus runs through the population, and that is something that you would have 1-2% mortality, which is a very high number in India. And the other way, I always said, this is by vaccinating people. And there are these lot of myths going on about vaccines, saying that there are these clots. Now the incidence, the prevalence of clots, if you see, is something which is very minimal, and that is something that is expected, and we don't know whether it's due to COVID or due to the vaccine. So the myths regarding the vaccine, and one dose, I think, also still covers about 60 to 70% of the efficacy of the population which is vaccinated. The mutant viruses in the neutralization assays, which means in the laboratory might not show effect, but if you look at the efficacy, it still does prevent mortality in those mutant viruses. So I think one of the best ways is to just keep vaccinating people, and even at least one dose to go to the second dose.
But doctor said that's the issue. We are not vaccinating fast enough. You know, there is the problem of vaccination shortage. There's a problem of quotas being assigned to each state of a very centralized process. Has the time come to review this entire process? Because at this rate, we are simply not vaccinating fast enough to cover particularly critical population. There's a belief now that we've got to start vaccinating all over 18, some of whom are very vulnerable in that 18 to 45 age group. Do you agree with that? Time to vaccinate all as fast as possible.
I partially agree with it. And let's just say that in the first 2 months of vaccination drive, I think we did the right thing of prioritization. That puts in an infrastructure into place, that puts logistics into place, and that puts the feasibility into place. And also, by the way, watches for side effects, which can only be seen when mass vaccination occurs rather than just the trials itself. But once that's true, and at this present stage, like I said before, the syllabus has changed completely. The exam is the same, but the syllabus is different. And now when we actually have the spike, we got to rethink our strategies, redefine them. And the only redefinition comes in are three aspects. What does protect deaths? What does protect admissions into the hospital? Vaccination and COVID appropriate behavior. These are the only two which will save us. So if they are, then let's go and actually ramp up the vaccination drive. I keep hearing odd comments or opposing comments about the availability of vaccines. There's a group which says there's a whole lot of vaccines available, and then there's the other group which says, but then we've got a dearth of vaccination. I still don't understand the lack of transparency around vaccine supplies. Let's leave politics out of it, but clearly, now's the time to define that. Forget the vaccine hesitancy. There are a number of people who want that vaccine as well. There's no time to coax people, no time to urge people. This is the only time that whoever comes forward has the vaccine, because he will be one of those chains that you can interrupt. Now, that may take 2 weeks, that may take 3 weeks, that may say it's after the second dose, but even the first dose offers immunity after 3 weeks, and that's a very important aspect. So if we don't want this to translate into greater and greater disasters, let's act now and let's not act later. And by the way, that's the very important aspect. And now that we absolutely have a Sputnik going through an emergency user authorization very shortly, and its availability of nearly 250 million doses coming through Reddy's and 5 other vendors, I think we should ramp that up more rapidly to have more vaccines available to us. And finally, Rajdeep, so we can do all this. And can I just say, just one more? Just one more. I think COVID appropriate behavior, I mean, it has to be mandated. It has to become a rule. There has to be a strict implementation of, these are the only 2 things that we need to do apart from micro containment zones. But by the way, when healthcare system gets overwhelmed, like is happening in Maharashtra, that's the time when you actually have to have a temporary lockdown, because otherwise people would die because the healthcare system there is getting overwhelmed, though that is not the case for the rest of the India.
Dr. Girdhar Babu, then in conclusion, as an epidemiologist, do we wait for herd immunity to grow? Is that the only way eventually that we will conquer COVID? Or is ramping up vaccination and making it available to all now the only way forward?
Yeah, in summary, I'll have 4 points. First one, ramping up vaccination is absolutely essential. And this will most probably prevent the 3rd wave, but will not have impact on the 2nd wave. So therefore, the second option is strong containment measures, which will ensure that people are isolated and ensure that it is not spread to many more areas, especially rural areas. That is the need of the hour. The third aspect is regarding lockdown. There is a misconception that a nationwide lockdown will actually reduce the transmission. This is wrong, because already at least 4 or 5 states have the reproductive number more than 2.8, which means each person spreading to 3 people in the states of Uttar Pradesh, Bihar, Chhattisgarh. So therefore, we have to make local action plans and implement locally whatever we are doing. The final thing is, as Dr. Ashok said and everyone else has alluded to, COVID appropriate behavior is something which will come from a better communication from every level. The kind of seriousness that we have seen in the last year, we just cannot compare. While the virus has become much faster in spreading, our complacency is also kept up with the pace of the virus speed. So therefore, we need to make serious changes in communication regarding virus, communication regarding vaccine. Most people don't know vaccine is taken for preventing death. There are a lot of rumors saying around we took the vaccine, even then they're tested for positive COVID-19. So these are the misconceptions and myths we need to actually clear. Therefore, there's a greater role for better communication right now, Rajdeep.